Hi there, this is Joshua at Connecticut River Acupuncture. I wanted to make a short video regarding the different size engaged needles that I use in my acupuncture practice. Often I get the question from my patients how big are the needles, or prospective patients, they're really concerned about the size of needles. First, I want to say that you can fit 20 acupuncture standard size needles into a hypodermic needle, which is very, very small. It means that the acupuncture needles are typically the width of a hair, sometimes a little bit thicker. But I'm going to go through 4 different types of needles that I use and the parts of the body that I use them on. So the first needle that I'll use typically in the face is the size is 0.16 millimeters by 15. So you can hardly even see it here. Typically I'm needling into the face with these needles, or if a patient is pretty sensitive to needling, I'll use these needles. They're very small. They move through the skin pretty easily. The second size needle that I typically use, this is my standard size needle, really the standard needle that I use for most of the body. And this is a 20 by 30, 0.20 millimeters times 30 millimeters. As you can see, it's still very small. It's the size of a hair, really. It's not big at all. You can see I can needle into my skin right here. That's not that bad. It happens really quickly. Take this out here. The needles themselves are stainless steel and they're very bendable. They do not break. They're stainless steel, so they're very resistant to that. If I were to put a lot of pressure, you can see it kind of bends it there. But that's the standard size needle that I'll use, the 0.20 times 30. And these are disposable, so I don't reuse these. I recycle them or throw them out after a treatment, in case you're concerned about that. The next size needle that I'll use is a 0.30 by 60, and this is, as you can see, slightly thicker than the last one. I'll typically use these in much fleshier areas, usually the buttocks, sometimes the lower back, or in really big muscles. Sometimes in thicker areas, whether there's fatty tissue or just very thick musculature, or sometimes on larger bodied patients, I'll use these needles so that I can get to a specific depth in which I'm trying to get to. So that's another size needle that I'll use. This is pretty standard as the one I just showed you. And then the last needle that I use in my clinic, and keep in mind that there are other size needles that other acupuncturists will use. Again, you'll most likely be getting this kind of medium size in a standard acupuncture treatment, depending on whichever practitioner you go to. But this is the final size acupuncture needle that I use in my clinic. And as you can see, it is much thicker than any of the other ones that I've shown you. However, my experience has been, and this has been echoed by my patients, that the thicker needles are actually less painful if there is any pain. For some reason, the thickness tends to go in more smoothly into the skin. I found that sometimes the thinner needles will have more of a kind of an uncomfortable response, if there is a response with the needling. And again, I'll use these in thicker areas like the lower back, usually the buttocks, sometimes the sides of the legs. I rarely, if ever, use needles that have this length or thickness in the abdomen. I definitely would never use this over the chest, which brings me to just a little comment about the depth and location. So I'll primarily use this kind of middle-sized needle for really anywhere on the body. I could use it in the face, and sometimes do use it in the face. Depending on where we're needling, we're going to be needling at a different depth as well as a different angle. So for instance, over the chest, we're going to come more kind of transverse oblique, sometimes even transverse, which means sort of parallel with the skin. If I'm needling over the lower back or the buttocks or fleshier areas, I'm going to go more perpendicularly. So it's going to go in like that. And even so, the depth is only going to be so much. And of course, in my training, we were taught and trained to be very conscious of the location in which we're needling in terms of any underlying internal organs or major vessels, arteries, and stuff like that. Say we're needling into the neck. If I were to needle into the neck, it would be very, very transverse. There's a point right here, stomach 9, that I'll actually put my other finger on and move the artery, move the vessel over so that I know and I'm feeling that pulsation of that vessel for me to go into this muscle that is adjacent to it. So overall, acupuncture is it's very safe. It's for an invasive technique. It's not invasive at all, really. And again, only in the larger regions of the body am I using sort of these thicker and longer needles so that I can get to the particular depth that becomes therapeutic. So that's the information I have about needles today. Thanks for listening. I hope it was helpful and hope that it makes acupuncture more attractive for you. Hope you have a great day. Thanks. Bye.